you say, much younger people, parents with young children even dying of cancer because they don't get treatment soon enough, because we've now got a national COVID service, not a national health service. What about the people who right now are probably shouting at the radio saying, but if we don't get on top of COVID, if we don't have a lockdown, and we don't get on top of COVID, then of course we're not going to be able to treat these people. They're not being treated because of the lockdown. They're not getting treatment because the hospitals are having to sort of deal with all these infections. What would you say to that?
So I say, look at the numbers. Actually, look at the real numbers. Don't believe the propaganda from government and from those that want to backdate their decisions with data they're looking for selectively. Look at the number of people in hospital. At the moment, there are 11,450 people in hospital with COVID-related illness. A lot of them would actually be in hospital anyway, and that's something you forget. They've got multiple comorbidities, they're complex, and they would be there anyway. They always come that winter. Since I've been a medical student, in October, things change in hospital. A lot of people come in, and it's even worse now because social care has dropped significantly over the last decade. So there's nowhere for a lot of lonely old people to go. They've been ill, they've recovered, but they can't get out of hospital, so they stay in hospital. Now, 11,000 people is less than 10% of the total bed capacity. It's 141,000 in the UK. Depends how you count it, but something like that. And so 11,000 is less than 10%. So at the moment, we're not flooded. Now, the lockdown is based on the premise from our rather dreary epidemiologists that within 2 weeks, the whole system will be flooded. We've been told not to talk about it. NHS colleagues have been told, look, just don't talk about it because you'll be in trouble if you do. But on the whole, the system is not overloaded now. And the numbers, everybody looks at them, and including my epidemiology colleagues, my rather more optimistic one and the positive one, and they say it's about to come down. We're reaching the cusp and it's going to turn round. So no need for a lockdown.
Well,